Good afternoon or good evening, depends on where you watching to us from. Um, Thank you, Dr. Jen. My name is Juliana. Sorry. Today I'm with Dr. Jen to go over a few questions regarding birth control. Most of the women that are watching us today, probably, or who are going to join us later on, probably has lots of questions regarding birth control because we have too many pills in the market to choose in between. So today we are going to focus on the progesterone only pill. And we have in here the Dr. Jen, Dr. Sophia Yen. She's CEO and co-founder of Pandia Health. And she's going to give us her professional advice regarding some questions on the progesterone only pill. And my first question, and it's a question that probably lots of women has, is what is this about progesterone only pill? What is it? Can you explain us a bit, please?
Yeah, so the progesterone only pill, sometimes called POP, you might have seen it typed, or mini pill, is only one hormone, progesterone. And the normal regular pill, when you say birth control pill, the pill, has estrogen and progesterone. And in general, we recommend the normal regular pill, and only if you have certain medical disorders such as liver cancer, breast cancer, blood clotting problems, or you're breastfeeding, do we recommend the progesterone only pill. And so that is one reason that we would recommend the progesterone only pill, any of those issues. And then the negative of the progesterone only pill is, well, we'll go over that a little bit later. But a progesterone only pill only has progesterone. And recently, until now, it's always been the progesterone. There's 8 different progesterones. And that's why the birth control pills, there's 40 different pills because there's 8 different progesterones, 2 or 3 different levels of estrogen. So between that mix, you get to about 40 different birth control regular pills with estrogen and progesterone in them. However, over here on the progesterone only, for the longest time, it has only been norethindrone. So there's many different names for the generic brand of norethindrone progesterone only pill, but there's only one progesterone only pill. And now there's a new one on the market, and it's called Slind. The problem is it's still name brand. It hasn't gone generic. So like all the other birth control pills are generic, including progesterone only and the standard birth control pill. But Slind is new and not generic. And so I don't even know how many years a patent lasts. If it's 3, 5, 10, 20 years, we'll have to Google that. But until it goes off patent, they can charge whatever they want. And unfortunately, in the United States, whatever they want, if you go on goodrx.com to check the price of Slind, it's $268 for one pack of pills, one pack of 28 pills. And if you get a discount, it's $193. And that's compared to your normal birth control pills, $15. So this is not even 10 times difference. It's more than 10 times difference.
Oh, wow. That's crazy. That's way too much. I think that like we have lots of women around us that you often hear them like, oh, I like the mini pill, but they might not be aware of all this that you are telling us today. We have here like, about Slind. Can you please confirm, is this a mini pill as well? Is it a progesterone only pill as well? And what is the main difference between this new Slind, this new brand that has gone out on the market now? With yes. What is the main difference with the old ones that are already in the market?
Great question. So the old progesterone only pills all have this specific progesterone, norethindrone. And again, because it's generic, it's relatively inexpensive. This new one is a brand, and it's new, and it's on patent, and it's the only one of its kind. And it has a progesterone that's called drospirenone. And drospirenone is the one, a lot of women are familiar with Yaz or Yasmin. So drospirenone is the progesterone that is in Yaz or Yasmin. But Yaz and Yasmin are your normal birth control pills. So they have estrogen and drospirenone. And Slind is just the drospirenone part without the estrogen. I like drospirenone because norethindrone, the old progesterone-only pill, has a lot of man side effects. And the man side effects are acne, hairiness, hunger, and bad cholesterol. And drospirenone doesn't have those side effects. Drospirenone is actually one of the strongest medications for acne out there. The negative of drospirenone is we always ask our patients, can you drink 8 glasses of water? Because if you can't drink 8 glasses of water, drospirenone has a slight theoretical diuretic effect. So it makes you pee. And if you pee and you don't drink enough water, then you're going to get a headache. And so I don't want patients having headaches. And so the other thing is, hopefully at some point, either we have to check your kidney, or at some point in your life, you've checked that your kidneys are okay. Because if you have bad kidneys, not good to use a diuretic, something that makes you pee more. So those are the risks of drospirenone. And that's what SLYND is. SLYND is drospirenone. And the benefit of SLYND, I don't think we covered it, is with a normal progesterone-only pill, in general, as a physician, we don't recommend that pill. We recommend you get the IUD with hormone, the implant, the shot. These are amazingly very effective methods. But the progesterone-only pill, this particular progesterone, you take it 3 hours late, you need to use an emergency contraception or you are at risk of pregnancy. The good news is with SLYND or drospirenone only progesterone, they pride themselves that you could take it 24 hours late. So this one, 3 hours late, you need emergency contraception or you might risk getting pregnant. This one you can take up to 24 hours late. We're not saying do that every day. We're saying, oops, you forgot, once a month, you could probably get away with that. And so that is another differentiator. The other reason that we would, that I don't like progesterone only pill, one, the risk of pregnancy, and you have to take it at the same time every day. But the other is I'm all about #periods optional, turning off periods. And with the progesterone only methods, each woman is different. We have no idea when you're going to get your periods. Some women will bleed every single day. Some women will bleed randomly. Some women will bleed on their regular schedule. Some women won't bleed at all. We don't know till we try it on you and see what happens with the progesterone only methods. With the regular pill, patch or ring, it's usually 3 weeks of hormone and then 1 week of a sugar pill or iron pill or 1 week off the method. And if you choose to skip the sugar pill or the week off and go straight into your next packet or straight into the next patch or straight into the next ring, though I wouldn't change the ring every 3 weeks, I would change it every 28 to 35 days, then you can skip your period. But with the progesterone only pills, you cannot skip your periods. As I mentioned, we have no idea what your bleeding periods are going to be. And oddly enough, with the progesterone only pills, it's 28 days of active pills. But with SLYND, they made it 24/4. Maybe they were trying to make regular periods, but the research of the manufacturers has shown that after a year on the medication, 26% of women that were using it still had had scheduled bleeding or spotting, and then 40% had random bleeding. So I am just an anal retentive control freak. I don't like random bleeding. I like to control my bleeding. I like to have no bleeding. So
do you like to be in control? That's good. So, but definitely with the progesterone only pill, you cannot be in control. It's like you're lucky, you can try it and you might go away with it or no.
Yeah, right? Each woman is different, have no idea. And the other thing is, they've checked that this medication is safe. They've checked that this medication prevents unplanned pregnancy, but we don't know the long-term effect on bone density. So that might be something in the back of my head, because with the shots, we know that affects bone density. But the shot is a very strong dose of medication. And this dose of medication, I don't know where it sits compared to this shot. Probably a pharmacist would know, or a pharmacologist, and we can look at it. So that would be my only other concern too, is that with the regular pills, you get some estrogen. And that's why at Pandia Health, the only academic doctor-founded company in this space, if you're under 30, we recommend 30 micrograms of estrogen. Because if you go on a low dose pill of 20 microgram or 10 microgram, and you're under the age of 30, it's not good for your bones. So the question is, now you're on a progesterone only pill, there's no estrogen. So does your
Absolutely.
body make enough estrogen, or is it bad for your bones? And it's just a matter of research. If we don't do the research, we don't know. And no one's paying for the research because nobody's paying for the research. Usually you pay for the research if you're a drug company because you have an interest, but they have no interest
Right.
in finding out that their pill is causing you bone problems.
Right. Yeah. That's an interesting, really interesting topic. We should make another live regarding, the low dose and all those effects in women's health. Really interested. Um, so you have just say the main difference between progesterone only pill and combined oral pill. We've seen that SLYND has a positive side, let's say, or a positive side. You can take it after 24 hours. Like, let's say that you have an oopsie and you forgot to take your pill, you can take it. But with the other old only progesterone pill, if you are late by 3 hours, you need to take emergency contraceptive or abstain.
Yes.
Otherwise, you will be in risk of pregnancy.
Yes.
What about the price difference?
So the price difference is progesterone only pill. You can get it for $10-15 a pack. At Pandia Health, we charge $15 a pack. However, Slind is $193 with a discount coupon, or let me look at it. Oh, I just had it go back. It is $268 for one pack of pills. So
that will cover you 1 month, right?
One month only. And if you had $268, that would cover like a year and a half of regular birth control pills. So it just isn't cost effective. If you have to do progesterone only and you can afford it, sure, but maybe condoms, right? Or definitely the IUD with hormone, the implant, or the shot. And if you're going to deliver a baby anyway, when you deliver the baby, they can put in the IUD with hormone, they can put in the implant because you're in the hospital already. Right. So anybody who's pregnant, this is, a consideration.
Yeah, totally. What about you've said about the hormone IUD, and what about the iron one? What are your thoughts about?
Oh, yes. So it's copper.
Copper, sorry, no
iron. Not iron. Iron wouldn't do anything. It's the copper that actually they believe inactivates the sperm and stops the sperm from working. And so the copper IUD is good if you are a woman who bleeds and you don't notice your periods. If you're a woman who gets your period and you have no cramps. However, if you're a woman who feels every period and you feel all the blood coming out and you're just like, I don't like blood, which is me. The copper IUD is not for you. The copper IUD, the two main side effects, more blood, more cramps. And I have all these women who are like, I have more blood, more cramps on the copper IUD. I was like, did your doctor not tell you? Those are the two side effects that you have to tell people: more blood, more cramps. And if you don't mind the blood, or you just happen to have too much blood and you just want to give away blood to the world, copper IUD. If you're a woman who just like, oh, I got my period, you didn't notice, copper IUD. But if you're a woman who's like, ow, 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 no, not copper IUD. No, I recommend
skip your period. If you're that kind of person, you need to skip your period.
Yes.
Right?
Yes.
Yeah.
And so I wouldn't recommend the copper IUD unless you don't feel your periods, you don't bleed too much, you don't mind bleeding too much, or you don't have any other options. The other part that the copper IUD comes in is for emergency contraception. So there are 2 emergency contraception pills and a third one where you just take a whole bunch of birth control pills. These are not as effective as the copper IUD. So if you are sexually assaulted or your condom popped or something like that, and you're okay with a copper IUD, it works 99.99999% effective as an emergency contraceptive. That is the only time I would personally consider the copper IUD. But again, to each their own. If you hate hormones, the copper IUD is a great option.
All right, cool. Talking about bleeding, excessive bleeding and stuff, we confirmed that you cannot skip your period with a progesterone only pill, right?
We have no idea how you're going to react. Some women with the shot, which is progesterone only, lose their periods. But with the progesterone only pill, we have seen all sorts of different reactions. And as I mentioned, 40% of women at a year using Slind still have random bleeding. But it might be lighter. But I would rather known period than random period. But each woman's different. Whatever
each woman's different. Yeah. And the needs choice as well, right? Because you say like the women that are using progesterone only pill is because they have certain needs, or they cannot use the regular combined pill. Yeah, the regular one. So they just have the option of the mini pill.
Or the IUD with hormone, or the implant, or the shot. So we always tell our patients, we're sorry, we can't give you the regular pill because you have these health issues. Please consider the IUD with hormone, the implant. I don't like the shot so much. And if not, we'll give you the progesterone only pill. But please consider these other options before you consider the progesterone only pill. Though there is this new one, it's pretty good, but crazy expensive.
Yeah, right. Too much money. So, all right. I think that we have gone through pretty much all the questions. We might maybe want to sum up a bit. The progesterone only pill, like doctor said, is only for those women that have pathologies as can be cancer. Maybe they are breastfeeding.
Breastfeeding.
Yeah, sorry. Or maybe migraines with aura and other symptoms. So they can
blood clotting problems.
Right. And they can use the progesterone only pill, but they need to be careful. If it's the old one, they need to take it with always at the same time, every day at the same time with an alarm. Oof. That sounds like a hard job for me.
Especially if you just had a baby and you're like, what time of day is it? You know, it's just once you have a baby, it's crazy for 3 months if you're breastfeeding. Right. So to remember at the same time every day, but maybe you're at home and you have an alarm, and so you can take it at the same time every day while you're breastfeeding.
Yeah, it depends on each woman's, right, in each case. But if you don't want, if you don't want to take the pill every day, all the alternatives will be the shot. Well, the shot is the last option. We will say IUD.
Yes.
It will be the, oh my goodness.
Implant?
Can you please, implant? Yeah, sorry. Implant. The implant or the shot. That will be the 3.
Yes.
And all right. And it could be the IUD as well with copper.
Yes.
The copper IUD as well, if you are not.
If you can't use estrogen, then copper IUD, IUD with hormone, implant, shot, and the progesterone only pill. But in that order is how I would recommend them. Consider the IUD with hormone is amazing. The only negative, again, is each woman is different. I think 30% of women will lose their periods, and I'd be like, yay! And then 70% will get lighter. But again, I'm a control freak. I probably, with my luck, would be part of that 70%, and I don't want to be part of that 70%. The other thing is the hormone in the IUD with hormone is one of the progesterones I don't like. It has more of the man side effects, and all the IUDs with hormone only have this hormone. And with the pill, I've got 7 or 8 different progesterones I can choose. But with the IUD, just one.
Correct. So, and also just because you have just mentioned it, what are the precautions or the recommendation that you will give to a woman that decides, let's say that the woman decides taking a Slind, that she can afford it? What are the precautions that she needs to have?
So the beautiful thing about Slind is we still recommend take it at the same time every day. But with Slind, you can take it up to 24 hours late, but we don't recommend that more than once a month. So don't make it a habit or just take it whenever you want. Ideally, you should take a pill every 24 hours. You can always take it early, But then the next time you got to take it early because this pill to this pill doesn't want more than 24 hours in between each pill. You don't want 48 hours between this pill and this pill because you took this one early and you took this one late, right? So one pill every 24 hours. The only risk is that your spironone might have a slight diuretic effect. And so to be anal, I tell all of my patients, please drink 8 glasses of water, because if it has a diuretic effect, you will pee. And if you don't have enough water in your body, you'll get headaches. And I work with teenagers a lot, and they get a lot of headaches because they don't drink water, because they don't want to go pee at their school because the bathrooms are disgusting. And so if you can't drink water, you're going to end up with a headache possibly. But that's the main risk. Some people you want to make sure you don't have any kidney problems, because if you have kidney problems and we throw on something, your peeing is controlled by your kidneys. So if you have a kidney problem, no SLYND for you, most likely. And then some people may want to check a blood test, a couple months on SLYND, or at least a blood test once before if you've never had your kidneys checked, just to make sure your kidneys are okay. But other than that, and then I don't know if we discussed this round or we discussed it in Spanish. We don't know, the long-term effects on your bone health. And we'll have to see.
Yeah. Yeah, I don't think that we discuss it in here in English, but yeah, I think that it's interesting if you please can mention it. Like, I think that is important information for all the women that might be watching today.
Okay, so the concern is that with the shot, which is very high dose progesterone, we know that it has some effect on your bone density. We also know with the regular birth control pills, if you have a 30 microgram estrogen pill, you're good. But if you're under 30 years old and the estrogen is less than 30, it's not good for your bone density. And so the question is with SLYND, which has 0 estrogen in it, if you're on that a very long time during your bone growth age, which is up until age 30, is when you build your bones. If you don't have the estrogen, does your body make enough estrogen, or will you have bone density issues like the women who are on the 20 microgram estrogen pill versus the women who are on the 30 microgram estrogen with progesterone? Both of these have progesterone. But if you're on a lower estrogen pill and you're under the age of 30, it's not good for your bones. And that's why at Pandia Health, the only academic doctor-founded company in this space, we're all about looking at the science and the papers and the research. And the science and the papers and the research recommend, in general, 30 micrograms of estrogen. Though some would argue, but the team at Stanford, I can say, goes one way, and the team in Pittsburgh, different school, goes another way.
Well, to be fair, I didn't have idea of all this information. I didn't have your medication. I mean, of course, your medication, depending on the medication, can have an effect on your health. But I didn't know that it could affect on your bone densities. Like, it will make them smaller. Is that correct? I don't know if I got the idea.
It will decrease your bone density. So bone density is how much calcium, how strong is your bone. And from age 15 to 30, you're getting more and more bone density. And then after 30, it just goes down. And so for Asian Americans, maybe Latinos and African Americans as well, who don't drink enough milk because lactose intolerance, then we don't get as much bone density. So we only get to here. And then when it starts to fall, we hit the fracture a lot easier. Whereas if you go up here and then you fall to here and you get a fracture, you don't get a fracture. But if you go down to here and you fall, you'll break your wrist, you'll break your hip, you'll break something. And so if you're on too low of estrogen and you're under the age of 30, you're not going to get as much bone density. If you're on Depo-Provera, they've shown that you don't get the bone density. The good news is when you come off Depo-Provera after, I think, 2 or 3 years, you get back to normal. So it does maybe come back to normal.
Yeah, but if you come off the shot after 35, will it come back to normal, or?
That is the question. I don't know if anyone's done that study. They took people off of it before and it came back to normal. But you're right. After, maybe it's too late. And that is the concern.
Right.
But for the shot, better to be on the shot if you need it for birth control than pregnant. Because pregnancy takes more calcium from your body. The baby sucks calcium off your body. So you need to make sure you put it back.
All
It's a
right.
risk benefit ratio. Do you want to be pregnant and have calcium sucked off you, or do you like Depo? But know that there's other options. There's other options.
Beautiful. Yeah. Well, that's the good thing. I think that's the positive side of this story. That thanks to the research and all the professionals in the health field, we are having more and more options. So women are not just, attached to the only shot or the only pill. And
Yes.
yeah, and I think that I want to thank you for being here with us and sharing all this important information, because like it's like when you go to the supermarket, you have tons of kind of rice or pasta, but you need to choose the one that it fits more your needs and what you're looking after, what you're looking for, sorry. So for going back to the progesterone only pill, this will fit to the women that have certain pathologies, that don't mind not to have a period or have it, because the woman needs to know that they cannot skip the period with the progesterone only pill. They need to know that there is two options. The newest one that we will is SLYND, which is crazy expensive because it's the exclusive, right? But it gives you the benefit that you can, if you have an OPSI and you forgot to take the pill on time, you can take it after 3 hours. There won't be a problem. Otherwise, the women have the cheaper option. Well, yeah, it's cheaper. It's generic, right? 20.
Yes.
Well, yeah. So the generic option will be the other progesterone only pill. The only bad thing in this pill will be that you need to take it every single day at the same time. And if you are later than 3 hours, you will be on risk of pregnancy. So you will need to either abstain or take emergency contraceptive pill. And we also need to mention that if the woman doesn't want to take any of those pills, either SLYND or the old version of it, the options that they have is the intrauterine, sorry, the positive.
Yes, intrauterine
device. Sorry. The intrauterine device. I just go with the shot always. I'm sorry. I've always forget about the implant.
Yeah.
Sorry. The implants. So in order, they will be option 1. It will be the Minera
IUD, Mirena, Loletta, Skyla, Kylina, and then the implant, and then the shot. The IUD, the implant, the shot.
Right. So many different IUD. I didn't know that. I only knew about the Mirena.
Yeah. No, the Mirena and the Loletta are the same, and they last for 5 to 7 years. And then there's Skyla and Kylina, which is less. I don't recommend the Skyla because it is a lower hormone, and therefore you bleed every single month. And the whole point for me is to not bleed every single month. And so with the Mirena and the Loletta, about 30% lose their periods in a year and 70% get lighter. With the Skyla, you're more likely to have a period every single month. So if you're doing something secret and your mom is watching your periods, then Skyla is the way to go because you will continue to have your periods. But outside of that, I would go with the normal in IUD with hormone, which is Mirena or Loletta, either one of those. And then Kylina is a little in between. They made it because these were going off patent and they wanted to have something else, or as a different company, I don't know. I just Googled, Slind is going to be on patent for 20 years. So they could still charge crazy money for 20 years, or they may realize no one's going to use them because they're ridiculously expensive. And maybe they'll drop it down to normal, which would be $20 or $15. And just for people to know, at Pandia Health, we carry every single brand, and we'll give you whatever you want. But know that if it's not covered by insurance, we'll have to charge you for the difference. But if you're okay with generics, then it's generally, if you don't have insurance, $15 per pack, which is 50 cents a day. But 3-pack minimum. If you buy 1 pack, it's $20 because you have to cover our labor, shipping, handling, legal, all that stuff. So, and then we have Pandia Health Birth Control Fund. If you can't afford it, you can apply to the fund. Though we need to solicit donations for the fund. So if you have money, please donate to the fund. But if you need the funds, then apply to the funds, and they can cover your birth control pills. Obviously, not Slind, and obviously generics.
Yeah. And yeah, even though if it's just one plug, I think that $20, my gosh, makes the huge difference in comparison with $260 crazy dollars per month. So yeah. All right. So thank you so much, Dr. Jen, for answering our questions and sharing all the information. Information give us power. Just wanted to remember everybody out there watching us today that if you are a woman and if you're in need of birth control, know that we have beautiful Pandia Health, Dr. Jen, and a beautiful team, hard workers, professional of the health women. And they can help you to get a new prescription for your birth control. You can ask as many questions as you want. They will advise you with the best method for you that match your needs and your health history. You can sign up. Yeah, you can sign up with us here, pandiahealth.com, and use the invite code Trending to get a $5 discount on the doctor's consultation, which is normally $20, to get a new prescription within 24 hours with a year's worth of refills. And also, we have the magnificent service of free delivery, so you don't have to worry about running to the pharmacy every month, and you can just rest home, peace of mind. Pandia Health is here to help you. Please sign up if you are in need of a birth control prescription at pandiahealth.com. Use the discount code Trending to get $5 discount. And if you have a prescription as well and you want to skip the trip to the pharmacy, please sign up with us. We can help you with free delivery. Sophia, again, thank you so much for taking the time to answer our questions, to provide all your professional advice. We really appreciate it. And yeah, I just want to thank everybody that has stopped by to watch us and get some information from this beautiful, amazing Dr. CEO and co-founder of Pandia Health. And join us every Tuesday. You can find us in here, and you can also follow us in Instagram. And we are very active in social media, and we are trying always to share information that can help the women out there. Thank you so much, Dr. Jen, and
thank you, Juliana.
Good evening to everybody.
Good night.
Good night. Now I'm gonna need to try to stop this on time. If it works.